Brought to you by ExpressCare Health and Skin Center. Get in, get out, get better.
Day and welcome back. We are talking about ovarian cysts and tumors, and if you're just tuning in, Doc is in and ready to answer some of our viewers' questions. All right, Doc. Our first viewer is asking, what does benign mean?
Benign means not malignant. Malignant means cancer. Benign means not cancer. So it means friendly, really. In Latin, the word means friendly. So nothing to worry about.
Okay. Our next viewer is asking, how do you know it is a cyst and not a cancer?
Well, sometimes it is a little hard to tell. Most of the cysts that are seen on ultrasound are fluid-filled, and they look like a black cavity. They just look black because there's nothing there that's solid. Solid tumors, meaning a cyst maybe that's got some parts that are clear, meaning black, and some parts that are more solid, looking white on the ultrasound, those ones can be biopsied. Usually a laparoscopic surgery will be done where they look inside and they take a little piece of it or take the whole thing out if it's looking dangerous. The strangest type of ovarian cyst or tumor is one that's called a dermoid, where you can find pieces of teeth, pieces of skin and hair in and around the ovary. It's not very common, but a strange thing if it's found.
Is that like from a birth or like being pregnant? I mean, how does the tooth
not
get
at all.
there?
It's how does the tooth get there? Well, because ovarian tissue contains some of our primordial cells, meaning our very beginning of our cells from when we were just a tiny, tiny, tiny little fetus. All of those, let's say, even stem cells. And so some of those cells didn't move along to the right location and went on and created other parts of our body. So you can have that very unusual tumor.
Wow, interesting. All right, our next viewer is asking, what about ovarian cancer? Who gets it?
Yeah, ovarian cancer is a really horrible disease, and it affects women typically in their 50s and 60s, in their postmenopausal years, although it can occur in younger women. And it's a difficult diagnosis to make sometimes because our pelvis is very large. You know, a baby doesn't start showing till you're 4 or 5 months pregnant, and it's already quite large, especially if there's some obesity there. So, and at that age, sometimes women are no longer menstruating, they have no irregular period, there's no way to tell. So that's why you should at least have a checkup, an internal checkup as a woman, at least every couple of years, even after menopause, to check the ovaries. And you find it usually by, if they have symptoms, then they're going to have some bloating, some swelling lower down, maybe some constipation, but these are late findings. So if there's a family history or if there's any suspicion, then a woman should definitely have a checkup and an ultrasound.
All right. Another viewer wants to know, what are the risk factors?
The most important risk factor is family history of breast cancer or ovarian, because they tend to go together. So that would be one thing. The other thing is if a woman has not had any children, that is a risk factor. Another is obesity and, of course, smoking.
Okay, now cysts in other parts of the body, let's say breast, does that also mean they're susceptible for
Not at
cysts?
all.
Oh.
That's a great question. Some women will have breast cysts. They may or may not have ovarian cysts, and it is not a risk factor for ovarian cancer.
All right. Now, another viewer is asking, how can it be detected?
Yeah, again, it is a little difficult to detect. So every couple of years, for sure, have your internal exam with your doctor to make sure your ovaries are healthy and fine. You can also have an ultrasound done. If you have any unusual symptoms like bloating, swelling, unusual water retention, these type of things should be checked with an ultrasound.
Now, another viewer is asking, can it be prevented?
Ovarian cancer can't really be prevented. I suppose you could have children and that would reduce your risk, but it can't be prevented. So it's something that needs to be detected hopefully early by having a regular checkup.
All right. And our last viewer is asking, what are treatment options?
Well, the most important treatment when a woman is diagnosed with ovarian cancer is to have the ovaries removed. So that they no longer grow and create problems that way. Sometimes radiation and chemotherapy is also necessary.
All right, thank you so much.
You're
Doc.
welcome.
You always give us such important information.
Thank you.
All right. Now the doc will be back with us next.